Hi Cavaliers, how are you all doing today? The reason for this video is because my Cavalier lady has recently been diagnosed with diabetes. I was completely shocked by it all. Absolutely shocked us all. We had no idea that she had diabetes, and we don't know anything about diabetes. We don't, well, I know a couple of people with diabetes, but you don't ask them all about it, dear. And also I sort of assume that dogs didn't get it because they don't eat sweets or chocolate or, you know. So I've decided to do this video for anyone who's got any questions about diabetes at all in dogs. All dogs, I suppose, are the same. Ladies are Cavalier. This side's about Cavaliers. But Cavaliers are related to Spaniels, so I guess it's the same thing. I've got a few notes, so I'm going to be looking. So essentially, I'm just going to list out the things to look for, because this is essentially what lady went through. We noticed that she was drinking a hell of a lot of water, and I mean bowls and bowls of it. Through the night, because she sleeps in our bedroom, through the night we had to leave a couple of bowls for her, quite big bowls as well, about this big. So 2 bowls, and she drank them dry. Normally she has a couple of sips of water through the night, that's it, but she was drinking it dry. So we thought, you know, that's not right, so we took her to the vets. So we initially thought she may have had a water infection or something like that. You know how it is. So we took her to the vets. The vets did, we took a urine sample in. The vets did a dip test and checked, and they noticed glucose in her urine. So basically, after a few tests, and they took away blood and did a lab test on her blood, which wasn't cheap, but it's got to be done. And they also discovered glucose in her blood, and that was fasting. She was fasted for that, so all through the night, no food, just water, and that was it. So that's how they found about glucose in her blood. So we found out on the Tuesday, and then on the Thursday we had a follow-up session with one of the nurses, and she was going to go through with us how to actually inject insulin. They went straight for injections, no tablets. I believe my diabetic friend Vinny, he told me that he has tablets, and but they went straight to injection with insulin. And Vinny's wife Pam, she said that with dogs they do go straight to insulin, so I don't know. But they went straight to insulin, and obviously they sort of they've got to have a starting dosage, because they're not entirely sure how much to have. So they said 4 units. There's an actual proper unit of, I don't know what it's called. I'll find out. It's a proper unit anyway. It's all new to me, so please bear with me. Anyway, the Thursday, she showed us what to do. Obviously didn't give it to her because she was fasting then, and had another urine test, and exactly the same again, glucose in her urine. So we had to wait until we got back home. She had something to eat, and then 15-30 minutes later, give her a first injection. Fine, she was fine and dandy. Bit quiet, bit bit under the weather sort of thing. So anyway, we thought, you know, that's because she's never had insulin before in her life. Maybe that's it. So there we go. Next thing we knew, oh no, actually, I think we give her a second injection. I'm trying to remember this because it was literally nearly 2 weeks ago, all this. I think we gave her a second... Yes, we did. We gave her a second injection, and she had like a sort of droopy eye. One was shut, one was droopy, And we were very concerned because we thought she was having a sort of allergic reaction or something. She has U-move because she's had a leg operation in the past, and so just helps with the joints and movement. So we give her U-move supplements, which isn't too bad. She has those, that's no problem. But we thought with the insulin and the U-move, we thought, is that the right thing? Because I forgot to mention it earlier. So we called the out of hours vets. They said to send them some photos, which we did. And the lady on the phone was speaking to the vet. She said to be on the safe side, book her in as an emergency patient. So we did. Obviously, she's our baby, so we took her into the vets, and the vet gave her a thorough check over. And then suggested she was fine. She was fine. There was nothing wrong with her. In fact, by the time we got into the vet, she was bright and running about and typical. But anyway, the emergency appointment again wasn't cheap. But they said to check in with our proper vet, who's not 24/7. But they're sort of like together. They know each other's medical records. So said check in with the vet in the morning, make sure that we're giving her the right dosage of insulin, which was the 4 units. So we did. We went in. They said we have to start somewhere, and then eventually they do a curve. They call it a curve. I'm not sure what it is, but I'm learning about this tomorrow. I've got to go back to the vets tomorrow to learn about the curve. You have to do glucose tests. So they said until we do that curve test, they're not sure how much to give her, so they just see how she goes. So that was that. I was happy with that answer. There we go. Anyway, going on. Let me just check. Yes. So later on that week. Yes, later on that week, it was a Friday night. She started acting a little strange and vomiting. And vomiting a lot. All the way through the night. I had to sleep downstairs. My wife had work in the morning, so I was off because it was a Friday night. So I slept downstairs, and she was vomiting literally all night, up and down, outside. I was with her because sometimes she won't go out the back. She likes to go out the front. So I walk up and down with her. And there was a lot of vomiting going on. And I just thought, sickness. Anyway, just checking my notes. Yes, that was the Friday night. So on the Saturday morning, we then took her outside for a wee. She had a wee, she was fine. And then I noticed a few drops at the end with blood in it. So I thought, right, off we go to the vets again. Saturday, out of hours, but it was an emergency appointment, so we went after. And then we took another urine sample. They checked again, and there was glucose, blood, and also ketones in the urine. Now, I wasn't aware, but ketones are pretty bad. Basically, the body isn't... I don't know everything, so please, if I'm getting any of this wrong, please let me know in the comments. Just I want to learn as much as possible, as well as teach others. So if anyone's an expert, please help me out here. I'm researching as much as I can, but I'm just telling you of our experience. So they found ketones, and apparently ketones in the urine mean that the sugar isn't being used as energy, but the body's eating up fat stores, I believe. Luckily, lady's a bit chunky, so she can afford to lose a bit of fat, but that's by the by, it's not good. So they admitted her, and they put her on a drip, and they She also had a UTI, a urinary tract infection, which is the blood in the urine. So they had to take her in. She was on paracetamol because she had a sore bladder, intravenous insulin, and also saline, just to keep her, hydrated. So that was that, and she was in Saturday night, Sunday day and night, Monday day, and we got her back out on Monday night. Now the trouble was, and still is basically, lady will not eat for anyone else other than myself, Sarah my wife, and Livy my daughter. She won't eat for anyone else. So because she wasn't eating, they said unless she eats for her insulin to kick in, they wouldn't discharge her. So every morning and every evening we had to keep going down to the vets and feeding lady, making sure, and she was totally unsettled because it's like being in the hospital, isn't it? Nobody likes it. So there she was in the vets, and we were in a little room trying to get her to eat, but she wouldn't eat, so we had to hand feed her just so we could get her out of the vets. Anyway, you do what you do, don't you? So we did. And then on the Monday night, she came out. Her ketones were still a little bit high, but not as high as they were. So they just said keep an eye on things. And then we took her to normal vets on the Tuesday morning. And they knew everything, obviously, because the two vets are tied together. And basically, we got some antibiotics. So all in all, with all the trips, the emergency appointments, the drugs, you name it, it cost a ballpark figure of £3,000, which is a lot of money. However, and luckily for us, ladies insured, you have to pay the excess, and because she's over 10 years old, you have to pay 20%, but 20% is better than 100%. So I'm just glad that we've got her insured. But this is she had 7 days worth of antibiotics, and today is the last day. Tomorrow I've got to take her to the vets, find out how to do the glucose curve test. So I'll show you all that. I don't know what it is. Apparently there's a form you have to fill out. So I'll make a copy of the form and, I don't know, make it downloadable or something. I'll pop in the comments. And that's about it. That's all I know at the moment. So as soon as she's a lot better. Very tired all the while. But, if anyone else has got a diabetic dog, can give advice. Is being tired all the while normal? She will peak a little bit on an evening, but that's about it. And then she'll go, as soon as she's had her insulin injection, she'll go tired again. I mean, we feed her they told us we did feed her 3 times a day, small amounts, but they said give her larger amounts, 1 in the morning and 1 in the evening, spaced apart and nothing in between, so that when she has her food, like a breakfast, we give it at 7 in the morning. Her sugars will spike, and then at 30 minutes after, 7:30, we'll give her an injection and she calms down. The sugars calm down, should I say. And then same again on the evening. She's about 7 o'clock on the evening as well, so it's 12 hours in between meals. I mean, I couldn't do that. I should do, really. But there you go. Anyway, so that's what we've been told to do, and that's what we're doing, basically. So we're going to carry on with that. Apparently she may have to have some more antibiotics, because apparently it was a bad UTI. So we'll have to wait and see, and I'll let you know. So If you can pop your paw on the like button, I'd appreciate it. Any advice, anything whatsoever, just pop it in the comments. Thank you. Bye bye.